Hi everybody, it's Dr. Eric Balcabbage and we're back for episode 9 of the Neuropathy and Diabetes Learning Series. And today we're talking about microvascular and versus macrovascular damage in diabetes. So how are the blood vessels damaged when you're diabetic? Well, we know that diabetes is associated with damage to the blood vessels, and damaged blood vessels can cause neuropathy because we get increased blood pressure due to the damage to the vessels. We get narrowing of the arteries. We get inflammation, we get decreased blood flow, and essentially we get hypoxia to the tissues and to the nerves, and that causes nerve damage. So what happens? So in the small blood vessels, it's believed that the primary cause to the damage of the blood vessels is increased uptake of glucose by the endothelial cells of the blood of these tiny small blood vessels, and that causes the increase of that polyol pathway we talked about. The glucose converts to alcohol. The alcohol increases oxidative stress and damage, and that damages the real tiny vessels, and this cascade occurs. In the big vessels in the heart, this macrovascular damage is typically caused by increased fatty acid oxidation. So what happens is fats are tried to be burned as a fuel. And what happens is there's two types of oxidation. There's beta oxidation, which is kind of the cleaner form, and there's omega oxidation, which is the dirtier form. And there's the upregulation of this fatty oxidation. That's the dirtier form. You get more waste products and toxins and reactive oxygen species as a result of that. Think of really bad gasoline and bad exhaust fumes. That bad metabolic waste that occurs from this fatty acid oxidation creates more damage to the big vessels. Once you get more damage to the big vessels, then you get the cascade occurs of the tissues, increased inflammation, increased immune response, increased plaquing, narrowing the vessels, and decreased blood flow and increased blood pressure, okay? So that is how damage occurs in diabetes, both of the small cells, the microvasculature, and the large cells in the heart. We call them macrovasculature.